Chronic insomnia could be quietly erasing your memories without you even noticing. Welcome to our special segment where we explore the mysteries of health and life. And today we're diving deep into a topic many of us experience, yet few truly grasp its profound importance: sleep. We often think of sleep simply as a time for our bodies to rest and recharge after a long day. But what if I told you that sleep is a complex process, vital for our brains, especially our memory capabilities? And that for millions of older adults worldwide, sleep is no longer an easy companion, but a persistent nightly battle directly impacting their cognitive clarity. In this in-depth documentary, we will unveil the mystery behind a lesser-known but incredibly crucial connection: the link between chronic insomnia and memory decline in older adults. This is no minor issue. It's a public health challenge growing increasingly urgent as the global population ages, with statistics showing approximately 1/3 of older adults in the US reporting sleep problems. We'll join leading experts in neurology, sleep medicine, and geriatrics to better understand how sleep impacts cognitive function, especially the process of memory consolidation. We'll explore the complex biological mechanisms that unfold in the brain when we sleep, and what happens when those mechanisms are disrupted by chronic insomnia. This isn't just a story about sleepless nights. It's a story about how we can protect our most precious assets: our memory, our mental sharpness, and our ability to fully enjoy life in our later years. We won't just present the problem, but also provide deep insights and practical evidence-based strategies to help you or your loved ones improve sleep quality and protect memory. Join us as we embark on this journey of discovery, and we hope that after watching you'll view sleep from an entirely new perspective, one filled with power and hope. To truly understand the connection between insomnia and memory, we first need to decode sleep itself. Sleep is not a passive state for the brain. On the contrary, it's a highly active and organized phase, essential for every function of the body and mind. Our sleep is divided into two main types: non-rapid eye movement, NREM sleep, and rapid eye movement, REM sleep. We cycle through these stages throughout the night, with each cycle lasting approximately 90 to 120 minutes, and a healthy adult typically experiences 4 to 6 such cycles each night. NREM sleep accounts for about 75–80% of total sleep time. It begins with stage 1 N1, a period of light drowsiness, where you can easily be awakened. This is followed by stage 2 N2, when the body relaxes, more heart rate and breathing slow down, and body temperature drops. This is the stage where we spend most of our sleep time. But most crucial for memory is stage 3 N3, also known as slow wave sleep or deep sleep. This is the deepest and most restorative stage of sleep. In N3, the brain produces slow, large delta waves while the body and brain perform crucial repair and regeneration activities. Specifically, this is when the brain's glymphatic system is most active. The glymphatic system, you can picture it as the brain's waste disposal system. It uses cerebrospinal fluid, CSF, to flush out metabolic waste products that accumulate throughout the day, including harmful proteins like beta-amyloid and tau, which are strongly linked to Alzheimer's disease and other forms of dementia. Without sufficient deep sleep, this system cannot function effectively, allowing waste products to build up and potentially damage neurons. After NREM sleep, we transition into REM sleep, which accounts for about 20–25% of sleep time. This is the stage where most vivid dreams occur. During REM sleep, brain activity increases to nearly waking levels, but the body experiences temporary paralysis, sleep paralysis, to prevent us from acting out our dreams. REM sleep plays an extremely important role in consolidating emotional memories, learning, and processing information. In this phase, the brain processes and organizes new memories, moving them from the hippocampus, a temporary storage area, to the cortex, where they are stored long-term. This is a critical process for transforming daily experiences into lasting memories. Additionally, sleep is regulated by two main processes: the circadian rhythm and sleep pressure. Our circadian clock, located in the hypothalamus of the brain, controls the body's 24-hour sleep-wake cycle, influenced by light and darkness. It regulates the release of the sleep-inducing hormone melatonin, which makes us feel tired at night. Sleep pressure is simpler. The longer we're awake, the sleepier we feel. In summary, sleep is a versatile process essential for physical recovery, hormone regulation, immune system enhancement, and most importantly for our topic, memory consolidation and cognitive function. Understanding how sleep works is the first step to recognizing its importance and why sleep disruption can have serious consequences for memory, especially as we age. If sleep is an indispensable friend, then chronic insomnia is a silent enemy, slowly eroding health and well-being. More than just a single sleepless night due to anxiety or an early morning awakening. Chronic insomnia is a serious medical condition affecting millions, especially older adults. Chronic insomnia is defined as persistent difficulty, falling asleep, staying asleep, or waking up too early, and being unable to return to sleep, leading to poor sleep quality. Importantly, these problems must occur at least 3 nights a week and last for at least 3 months. If it's just a few sleepless nights due to stress, that's acute insomnia, and it usually resolves on its own. But when it persists, it becomes a condition that needs attention. Chronic insomnia can manifest in several forms: sleep onset, insomnia, difficulty falling asleep, initially sleep maintenance, insomnia, waking up multiple times during the night and having trouble falling back asleep, or early morning awakening, insomnia, waking up too early in the morning and being unable to go back to sleep even if still tired. Regardless of the form, all lead to poor sleep quality and negative daytime consequences, such as fatigue, difficulty concentrating, irritability, anxiety, or headaches. Contrary to common misconception, insomnia is not an inevitable part of aging. While it's true that older adults may experience natural changes in sleep architecture, such as a decrease in deep sleep, N3 and REM sleep, chronic insomnia is not normal. In fact, older adults are one of the groups most affected by chronic insomnia. Statistics show that about 30–50% of older adults report sleep problems, and a significant proportion of them meet the diagnostic criteria for chronic insomnia. This rate is even higher in those with underlying medical conditions or who are taking multiple medications. Many older adults self-treat with over-the-counter medications or alcohol, but these methods often provide only temporary relief and can pose serious health risks. Undiagnosed and untreated insomnia can lead to a vicious cycle. Sleep deprivation causes other health problems, and those health problems in turn worsen insomnia. The consequences of chronic insomnia extend beyond daytime fatigue. It can lead to decreased productivity, increased risk of accidents, especially falls in older adults, exacerbate chronic health conditions like cardiovascular disease and diabetes, and increase the risk of psychological disorders such as depression and anxiety. And one of the most concerning yet often overlooked consequences is its impact on cognitive function, especially memory. To understand this, we need to delve deeper into how memory works. Memory is one of the most miraculous abilities of the human brain. It's not just the ability to recall names, dates, or events. It's the foundation of our identity, the bridge between our past, present, and future. It allows us to learn, adapt, and build social relationships. But memory is not a monolithic entity. It's a complex network of different systems, each with its own role. Brain regions like the hippocampus cortex, especially the prefrontal cortex and amygdala, all play crucial roles. To understand this better, let's explore the main components of memory. First is short-term memory, also known as working memory. This is the ability to hold a small amount of information in your mind and manipulate it for a short period. For example, when you remember a phone number you just heard or follow a conversation. The prefrontal cortex plays a key role in this type of memory. Next is long-term memory, where information is stored more permanently. Long-term memory is further divided into 2 main types. Explicit or declarative memory consists of memories that we can consciously access and express verbally. This includes episodic memory, which is the memory of specific personal events in your life. What you ate for breakfast yesterday, your last vacation, or your graduation day. The hippocampus is a crucial center for the formation of this memory. Semantic memory is general knowledge about the world. The capital of France is Paris. The law of gravity, the meaning of a certain word. The second type is implicit or non-declarative memory, which are memories we cannot consciously access, but they influence our behavior. Procedural memory is the ability to perform skills and habits, like riding a bicycle, playing a musical instrument, or driving without thinking about each step. The basal ganglia and cerebellum play important roles. There are also other types like conditioned learning and priming effects. The process of forming a memory involves 3 main steps: encoding when new information from our senses is converted into a form the brain can store. Consolidation is the step where information is processed and stabilized for long-term storage. This is the most critical step where sleep plays an indispensable role. When we sleep, especially during deep sleep, NREM, N3, and REM sleep, the brain actively processes and organizes memories from the hippocampus to the cortex where they are permanently stored. It's like moving files from your computer's temporary memory to the hard drive. Finally, retrieval is the ability to recall stored information when needed. Although the ability to learn and remember may change slightly with age, significant memory decline is not an inevitable part of healthy aging. The brain still has the capacity to adapt and learn new things until late in life, a phenomenon called neuroplasticity. However, when these sophisticated processes are disrupted, especially during the consolidation phase, the consequences can be very serious. And this is where chronic insomnia comes into play. Now we have understood sleep and memory separately. It's time to connect these two pieces and explore the deep, multifaceted link between chronic insomnia and memory decline in older adults. This connection is not merely a coincidence, but is reinforced by a wealth of scientific research and strong neurobiological evidence. There are several mechanisms by which chronic insomnia can devastate the memory of older adults. First is the disruption of memory consolidation. As we discussed, sleep, especially deep sleep, NREM, N3, and REM sleep, is essential for memory consolidation. During these stages, the brain transfers memories from the hippocampus to the cortex for long-term storage. Chronic insomnia, by significantly reducing the duration and quality of deep and REM sleep, directly disrupts this vital process. When you don't get enough sleep, newly formed memories from the day are not effectively saved, making it difficult to recall them later. This particularly affects episodic and semantic memory. Second is the decline in glymphatic system function. This is perhaps one of the most alarming mechanisms. The brain's glymphatic system, acting as a waste management system, operates most efficiently during deep sleep. Its primary function is to remove metabolic waste products, including toxic proteins like beta-amyloid and Tau. The accumulation of these proteins is considered an early sign and a major cause of Alzheimer's disease. With chronic insomnia, the glymphatic system is impaired, leading to the accumulation of amyloid beta and tau proteins in the brain. This buildup can form plaques and tangles, causing neuronal damage, inflammation, and ultimately cognitive decline and memory loss. This creates a vicious cycle. Sleep deprivation leads to amyloid accumulation, and amyloid in turn disrupts sleep, worsening the insomnia. Third is hormonal and neurotransmitter imbalance. Sleep plays a crucial role in regulating hormones and neurotransmitters that affect mood, alertness, and cognitive function. Chronic sleep deprivation increases levels of the stress hormone cortisol. Chronically high cortisol can be toxic to the hippocampus, a brain region critical for memory, leading to its shrinkage and impaired function. At the same time, sleep deprivation also disrupts melatonin production, disturbing the circadian rhythm and sleep quality. Insomnia can also alter the levels of neurotransmitters, such as dopamine, serotonin, and acetylcholine, all of which are important for attention, concentration, and memory. Fourth is inflammation and oxidative stress. Chronic insomnia is a stressor on the body and can lead to chronic systemic inflammation. Prolonged inflammation, even at low levels, can harm brain cells and blood vessels, damaging the blood-brain barrier and affecting cognitive function. Additionally, sleep deprivation also increases oxidative stress in the brain. Oxidative stress occurs when there is an imbalance between harmful free radicals and the body's antioxidant capacity. Free radicals can damage DNA, proteins, and lipids in brain cells, contributing to cognitive decline and the brain's aging process. Fifth is the impact on neuroplasticity. Neuroplasticity is the brain's ability to change and adapt, forming new connections and strengthening existing ones. This process is crucial for learning and memory. Sleep plays a vital role in fine-tuning neural connections, pruning weak ones, and strengthening strong ones. Chronic insomnia weakens this plasticity, reducing the brain's ability to learn and remember new information. Finally, it's necessary to differentiate between normal and pathological cognitive decline. It's important to distinguish between mild, normal, age-related cognitive decline and cognitive impairment due to disease or treatable factors like insomnia. Normal age-related cognitive decline typically involves occasionally forgetting names or an appointment, but daily functioning and independence are not significantly affected. In contrast, cognitive decline associated with chronic insomnia can exacerbate these issues, leading to more significant difficulties in remembering new information, concentrating, problem-solving, and even performing daily activities. This can be a factor that accelerates or worsens mild cognitive impairment (MCI), and in some cases increases the risk of progression to dementia. In summary, the connection between chronic insomnia and memory loss in older adults is not just a coincidence, but a complex chain of biological events that deeply affects brain function and health. Recognizing and treating chronic insomnia early can be an important step in protecting memory and enhancing the quality of life for older adults. We have understood the severity of chronic insomnia and its impact on memory. But why are older adults particularly susceptible to this problem? The answer lies in the complex interplay of multiple factors: biological, medical, psychological, and environmental. Let's look at the main contributing factors. First are biological and age-related changes. As we age, there are natural changes in sleep architecture and quality. Older adults often spend less time in the deep sleep N3 stage, which is most crucial for physical and mental restoration, and important for glymphatic system activity. The pineal gland, which produces the hormone melatonin that helps regulate sleep, tends to produce less of this hormone with age, disrupting the natural circadian rhythm. The intrinsic circadian clock of older adults may shift, causing them to feel sleepy earlier in the evening and wake up earlier in the morning, advanced sleep phase, or vice versa. The ability to recover from a night of sleep deprivation can also decrease, making older adults more vulnerable to sleep disruptions. Second are medical conditions and chronic diseases. Many health conditions common in older adults can directly disrupt sleep. Chronic pain, such as from arthritis, back pain, or neuropathic pain, can make it difficult to fall asleep or cause awakenings during the night. Cardiovascular diseases like congestive heart failure or high blood pressure can also have an impact. Respiratory conditions such as chronic obstructive pulmonary disease, COPD, asthma, and especially sleep apnea are major risk factors. Sleep apnea is a serious condition where breathing repeatedly stops and starts during the night, causing repeated sleep disruptions and reduced brain oxygen, which is known to be directly linked to cognitive decline. Diabetes, with unstable blood sugar levels, urinary problems with increased nighttime urination, nocturia due to an enlarged prostate in men, or an overactive bladder in both sexes, or restless legs. Syndrome RLS, with uncomfortable sensations in the legs, are all common causes. Even neurodegenerative diseases like Parkinson's and Alzheimer's not only affect memory, but also disrupt the sleep-wake cycle. Third are medication side effects. Older adults often take multiple medications simultaneously to manage various health conditions, polypharmacy. Many medications have side effects that disrupt sleep: diuretics, increase nighttime urination. Some antidepressants can cause drowsiness or insomnia. Beta blockers used for cardiovascular disease can cause insomnia. Corticosteroids can increase alertness. And many cold and allergy medications contain stimulants or antihistamines that can cause daytime drowsiness but disrupt nighttime sleep. Fourth are psychological and emotional factors. Psychological issues can be a major cause of insomnia at any age, but they are particularly common in older adults. Depression and anxiety often coexist with insomnia. People with depression may wake up early, while anxious individuals may have difficulty falling asleep due to racing thoughts. Stress from life events such as bereavement, retirement, moving, or worries about health and finances can cause significant tension affecting sleep. Loneliness and social isolation can also lead to depression and lack of stimulation, affecting circadian rhythm and sleep quality. Finally, lifestyle and environmental factors play a crucial role. Daily habits and the living environment also contribute significantly. Evening consumption of caffeine and alcohol can disrupt sleep. Nicotine is also a stimulant. Lack of regular physical activity, which typically improves sleep, but exercising too close to bedtime can be stimulating. Improper napping too long or too late can reduce sleep pressure at night. A suboptimal sleep environment, such as a bedroom that is too noisy, too bright, too hot, or too cold, can all be disruptive. The habit of using electronic devices with exposure to blue light from screens before bed can inhibit melatonin production. Irregular sleep schedules with inconsistent bedtimes and wake-up times also contribute to insomnia. The combination of these factors explains why older adults often face greater challenges in achieving quality sleep. Identifying and addressing each of these factors is the first step to improving sleep and consequently protecting memory. Early recognition of the signs of chronic insomnia and memory decline is crucial for timely intervention. Sometimes these changes occur gradually, making them difficult to notice, or we might dismiss them as just a sign of old age. However, recognizing these warning signs can make a significant difference. Let's review the main signs you or your loved ones might be experiencing. Signs of chronic insomnia include difficulty falling asleep, taking more than 30 minutes to fall asleep after getting into bed despite feeling tired. Difficulty staying asleep, waking up multiple times during the night, and having trouble falling back asleep or lying awake for extended periods. And waking up too early, waking up earlier than desired, and being unable to go back to sleep even if the total sleep time was insufficient. In addition to nighttime sleep problems, the following daytime signs are also very important. Daytime fatigue and low energy feeling, sluggish, sleepy, and not having enough energy for daily activities. Difficulty concentrating or paying attention, having trouble staying focused on a task, easily distracted. Decreased performance at work or daily activities, reduced quality of work or hobbies due to sleep deprivation. Irritability or mood changes, becoming more easily angered, sad or anxious than usual. Headaches or physical discomfort. Headaches, muscle aches, gastrointestinal discomfort due to lack of sleep. Drowsiness while driving or engaging in dangerous activities. High risk of accidents due to reduced reflexes and alertness. An increased need for napping frequently, taking long naps or falling asleep during the day. Regarding signs of memory decline, we need to pay attention to forgetting recent events or information, which is the most common sign. For example, forgetting what you ate for breakfast yesterday, a recent conversation, or an important appointment. Difficulty finding words or names, frequently using that thing or what's it called. Frequently misplacing items, for example, putting keys in the refrigerator or phone in the closet and not remembering where they were placed. Repeating questions or stories multiple times within a short period. Difficulty with problem solving or planning, for example. Struggling to manage finances, cook from a recipe, or keep track of bills. Disorientation regarding time or place, not knowing what day it is, what season it is, or getting lost in familiar places. Changes in mood or personality, becoming more irritable, anxious, or apathetic than usual. Difficulty completing familiar tasks, for example, driving to a familiar location, making coffee, or using household appliances. Decreased judgment, making poor or inappropriate decisions. It's important to differentiate between normal age-related forgetfulness and more concerning signs. Everyone can occasionally forget a name or misplace an item. However, if these problems occur, frequently worsen over time, and begin to affect your ability to function daily, then it's time to seriously consider seeking help. If you or a loved one are experiencing any of these signs, especially a combination of sleep and memory issues, do not hesitate to seek help from a doctor. Early diagnosis and timely intervention can slow down or even improve the condition. When signs of chronic insomnia and memory decline appear, the next step is to seek an accurate diagnosis. Diagnosis not only identifies the problem, but also helps rule out other causes and establish a suitable treatment plan. This is a comprehensive evaluation process, often involving multiple specialties. The diagnostic process typically begins with a visit to a family doctor or geriatrician who can refer you to other specialists if needed. The doctor will meticulously ask about your medical history, current medications, lifestyle, and especially sleep symptoms and memory problems. They may ask you or your loved one to answer detailed questions about sleep habits, bedtime, wake-up time, time to fall asleep, number of awakenings overall, sleep quality, daytime symptoms, level of fatigue, sleepiness, difficulty, concentrating, memory issues, specifics about the type of forgetfulness, frequency, and impact on daily life, health history, any chronic illnesses, surgeries, or head injuries, medications, a full list of prescription and over-the-counter drug supplements, and mood and mental health symptoms of depression, anxiety, stress. A physical exam and basic laboratory tests will also be performed to rule out other medical causes such as anemia, thyroid disorders, vitamin B12 deficiency, or kidney-liver problems that can affect both sleep and cognition. To get a more accurate picture of your sleep patterns, your doctor may ask you to keep a sleep diary for 1 to 2 weeks, recording bedtime, wake-up time, number of awakenings, nap times, and levels of alertness, fatigue. Additionally, a small wrist-worn device called an actigraphy may be used to record activity and rest patterns, providing objective data on your sleep-wake cycle. If an underlying sleep disorder such as sleep apnea or restless leg syndrome is suspected, your doctor may order a sleep study, polysomnography, PSG. This is a comprehensive test usually conducted overnight in a sleep lab. While you sleep, sensors will record brainwave activity EEG to identify sleep stages, eye movements, EOG to detect REM sleep muscle tone, EMG to detect leg movements or motor disorders, heart rate and breathing, to detect sleep apnea or other respiratory problems, and blood oxygen levels to check if oxygen levels drop during the night. PSG results provide a detailed picture of sleep quality and disorders. To assess memory decline, cognitive tests are used. Cognitive screenings through quick tests like the Mini Mental State Examination, MMSE, or Montreal Cognitive Assessment, MOCA, can provide an overview of various cognitive functions. If needed, a neuropsychologist can administer a battery of more detailed tests to evaluate specific areas of cognition such as memory, attention, language, and executive function. A comprehensive neuropsychological evaluation, brain imaging MRI or CT scan may be performed to rule out other causes of memory loss, such as stroke, brain tumors, or severe brain atrophy. In the future, techniques like PET scans may help detect amyloid plaques or tau tangles earlier. This diagnostic process requires coordination among multiple specialists: family doctor, sleep medicine specialist, neurologist, and neuropsychologist. Accurate diagnosis is key to identifying the root causes and providing the most effective treatment plan. Never self-diagnose or rely on unverified information. Your health is precious. Trust healthcare professionals. The good news is that chronic insomnia and sleep-related memory decline are not a life sentence. There are many effective evidence-based strategies and interventions that can help improve sleep quality and in turn protect or even enhance cognitive function, especially in older adults. We will focus on non-pharmacological methods, which are considered the first line and most sustainable solutions, along with some medical interventions. Non-pharmacological interventions include cognitive behavioral therapy for insomnia, CBTI. CBTI is the most effective non-drug treatment for insomnia and is recommended as the first-line treatment for chronic insomnia across all age groups, including older adults. It focuses on changing negative thoughts and behaviors about sleep. CBTI typically includes components such as stimulus control, which helps break the association between the bed and wakefulness by only going to bed when sleepy and getting out of bed if unable to sleep after 20 minutes. Sleep restriction aims to reduce time in bed to increase sleep pressure and make sleep more efficient. Cognitive therapy helps identify and change negative or distorted thoughts about sleep. Sleep hygiene education provides information on healthy habits for good sleep, and relaxation techniques help relax the body and mind before sleep. Improving sleep hygiene is also foundational for healthy sleep and a crucial part of CBTI. This includes establishing a regular sleep schedule, going to bed, and waking up at the same time every day, including weekends. Creating an ideal sleep environment bedroom that is dark, quiet, and cool, avoiding stimulants, caffeine, alcohol, nicotine in the afternoon and evening, avoiding heavy meals before bed. Limiting naps if needed, keep them short, 15-20 minutes, and early in the afternoon, exercising regularly, but avoid exercising too close to bedtime and limiting time in bed for activities other than sleep. Managing stress and anxiety is another critical factor, as they are major causes of insomnia. Learn relaxation techniques such as meditation, yoga, deep breathing, or progressive muscle relaxation. Dedicate time to hobbies and social connections to reduce loneliness and improve mood. If stress or anxiety is excessive, seek professional support from a therapist or counselor. Regarding pharmacological interventions, sleeping pills may be used in some cases, but with extreme caution, especially in older adults. They are generally recommended for short-term use or in cases of severe insomnia and always under a doctor's supervision. Older adults are more sensitive to the side effects of sleeping pills, including daytime drowsiness, increased risk of falls, cognitive impairment, and potential dependence. Some sleeping pills can worsen existing memory problems. Never self-medicate with over-the-counter sleep aids or use someone else's prescription. A doctor will assess the benefits and risks and select the most appropriate medication if needed. Beyond direct interventions, an overall healthy lifestyle plays a vital role in supporting sleep and brain health. Regular exercise helps improve deep sleep and reduce anxiety, depression symptoms. A healthy diet rich in vegetables, fruits, whole grains, lean protein, and healthy fats Mediterranean diet has been shown to benefit brain health. Limit processed foods, sugar, and unhealthy fats. Morning light exposure helps regulate the circadian rhythm and enhances melatonin production in the evening. Effective management of underlying health conditions, such as sleep apnea, e.g., using a CPAP machine. Chronic pain or diabetes will directly improve sleep. Avoid alcohol and smoking. Engage in mentally stimulating activities like reading, solving puzzles, learning a new skill, or playing a musical instrument, which can help maintain mental sharpness and brain flexibility. Some people find benefit from complementary therapies like massage, acupuncture, or herbs, but always consult your doctor before using them. Improving sleep and memory is a journey, not an instant destination. Persistence and commitment to lifestyle changes are crucial. If one method doesn't work, don't get discouraged. Discuss with your doctor to find the strategy that best suits you. Chronic insomnia and memory decline not only affect the individual, but also profoundly impact family and caregivers. Living with these challenges requires understanding, patience, and a strong support system. For older adults experiencing insomnia and memory decline, the first step is to accept that this is a medical issue that needs to be addressed, not a sign of weakness. Do not hesitate to seek support from family, friends, and healthcare professionals. Be patient with yourself. The improvement process can be slow and uneven. Focus on what you can control, such as maintaining a healthy lifestyle, implementing learned strategies, and adhering to the treatment plan. Stay socially and mentally active by continuing to engage in social activities, hobbies, and mentally stimulating activities. Interaction and mental challenge are crucial for maintaining cognitive function. Establish routines and a supportive environment by making to-do lists using calendars, phone reminders, and notes. Keep important items in the same place. Maintain a structured daily schedule. Using assistive technology such as reminder apps, sleep tracking smartwatches, or smart light temperature controls can also be helpful. Caregivers play an incredibly important role in supporting their loved ones. Educate yourself by learning as much as possible about chronic insomnia, memory decline, and related conditions. Knowledge is power for effective understanding and support. Listen patiently to your loved one's concerns and difficulties, showing empathy and reassurance. Support treatment adherence by helping your loved one remember doctor's appointments, take medications on time, and implement recommended lifestyle changes. Create a sleep and cognitive supportive environment by ensuring the bedroom is quiet, dark, cool, and help establish a regular sleep schedule. Create an organized living environment, minimizing clutter to make it easier to locate items. Encourage participation in appropriate physical activities and mentally stimulating activities. Ensure safety for those with significant memory impairment by ensuring a safe living environment to prevent falls or getting lost. Manage expectations by understanding that not all cases can fully recover. The goal is to manage symptoms, slow progression, and improve quality of life. Finally, seek support for yourself, as caregiving can be very stressful. Look for caregiver support groups, counseling, and make time for yourself to avoid caregiver burnout. The caregiver's health is extremely important. Communicate openly with the healthcare team, sharing your observations about your loved one's sleep and memory with the doctor, as you can provide important information that the person may not be able to articulate themselves. Family unity and support, along with the guidance of healthcare professionals, are key to overcoming these challenges. Recognize that this is a journey, and every small step forward is worth celebrating. As we conclude this journey of exploring the complex connection between chronic insomnia and memory loss in older adults, it's crucial to look ahead with hope and the understanding that science is constantly evolving. The future outlook includes deeper research into the glymphatic system, personalized sleep medicine with the development of technology, and big data, new medications and therapies with fewer side effects, increasingly sophisticated home monitoring technologies, and a growing emphasis on prevention and early intervention strategies starting from middle age. Throughout this journey, we have seen that sleep is not merely a biological necessity, but an essential pillar for our brain health and memory, especially as we age. Chronic insomnia is not a minor issue or a normal sign of aging. It is a silent foe that can devastate cognitive function and quality of life. However, the most important message we want to convey is, there is hope. We have the power to make a difference. With the right knowledge, professional medical support, and a commitment to implementing effective strategies, older adults can significantly improve their sleep quality and in turn protect their most valuable assets, memory and cognitive clarity. Do not hesitate to seek help if you or a loved one are experiencing sleep or memory problems. Make prioritizing sleep an indispensable part of your overall health plan. Quality sleep not only brings rest to the body, but also forms the foundation for a sharp mind, a full life, and a future filled with memories. If you found this information helpful, please share it with anyone you think might benefit. Leave a comment below if you have any questions or would like to share your own experiences. Important note: the information in this video is for educational and general informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.